AskReddit on Reddit rundown. Medical professionals of Reddit, when did you have to tell a patient I've seen it all before to comfort them, but really you had never seen something so bad, or of that nature? Probably too late to the party, but I had a lady come into the ER listed as multiple medical problems. This usually means diabetes and the issues stemming from it, or maybe bleeding issues from another disease, or maybe odd blood test results at a clinic. I hadn't seen the patient yet, but the doctor came to the nurse's station asking who had room 15. I jumped up and followed him into the room. I walked in and saw what I thought was a corpse. Then the patient's eye swiveled over to look at me. She truly looked like one of the people they found in a concentration camp. I could see every bone and her body was twisted in a decorticate position with her jaw locked open. Then the smell hit me, rotting flesh, death, and body fluids. I struggled to keep a neutral face and not gag. I tried to place a blood pressure cuff on her arm, and her skin just started flaking off in my hands. I gagged. The doctor started removing her clothes to examine her. Her feet were black to the ankles. Her hip bones were poking through her skin and were black. The skin around her ribs was worn away to oozing muscle fibers. Her calves were incredibly swollen, and the skin was splitting like ripped pants. I removed her depends, and there was feces coating her entire genital area. Then the doctor went to remove a large bandage on her lower back. Her entire sacrum was exposed, and the bones were black. The skin around it was a black liquefied mass. It smelled like nothing I've ever smelled. I can't even describe it. The doctor told her family I would clean up her ulcers and wounds in preparation for surgery. Liar. No surgeon would operate on her. I had no idea how to clean dead bone tissue and liquefied skin. They don't cover that in nursing school. When I went to clean her sacral area, all the liquefied skin separated and oozed all over the bed. I really struggled to keep my shit together. Afterwards, I needed a moment in the supply closet to cry it out for a second. I had no idea the human body could break down so much without dying. I still think about that woman sometimes and what led to her living like that. It still breaks my heart. In dental school, I had an emergency patient come in, complaining of sore gums. Upon examination, I found a massive calculus bridge, Google it for pictures, behind her lower front teeth. She only had about 3 remaining lower teeth, but they were all connected with a whitish brown mineral deposit that was about the size of a golf ball. She had never had her teeth cleaned, and she was probably 55 or so. I basically performed an emergency cleaning. She could speak so much better afterwards. Of course I had to play it off like it was normal, but in my years of practice I still haven't seen a case that bad again. Get your teeth cleaned, people. Even if you can't afford every 6 months, once a year, or every other year is a hell of a lot better than never. 5 years ago, I spent 6 months working in a small rural Zambian hospital in the medical ward as part of a volunteer/outreach program. I have done mostly family medicine, some surgery in my early days, but decided to mix life up a bit. The hospital was typical third world, a few basic medications, rudimentary clinical tools, a small lab on site, which was usually broken, no resuscitation tools whatsoever. HIV, TB, and malaria was rife. It would not be uncommon to encounter a death per day despite our best efforts. On one of my first days there, an unconscious person was carried in by a mob of locals. I could smell him before I saw him because he had been in a house fire and his skin was cooked, completely black around his chest, face, and over his legs. He was still breathing on his own and maintaining his airway, but we had no doubt he had inhaled a lot of smoke. With no way to intubate or provide oxygen, we merely had to hope that he didn't swell up and close off and deal with the rest of the burns while he was unconscious. Two colleagues who worked in the hospital came over urgently. We all kept our cool externally and got the nurses to translate to the man's family that we were going to do everything we could to get him better. In reality, all 3 of us knew his chances at survival were in the single-digit percentages. We decided that due to the extent of his burns we were going to have to do an escherotomy, cutting the burned skin to prevent it contracting and stopping him from breathing. Turns out I had the most surgical experience, so despite having never done one before, I gave it a go, hoping for the best. We got an IV into a neck vein and got fluids going. The local nurses dressed his burns. We gave him whatever pain relief we had. He was unconscious for a couple of days, but eventually came to. Each day we were expecting his kidneys to pack up, but to our surprise, gradually he got better. He was with us for just over 4 months recovering. He came out severely scarred, but he had beaten the odds and survived. I'm a nurse, and I work in a pediatric ER. A young woman brought her baby in to be seen for vomiting. I asked her to put the baby on the scale. While on the scale I noticed a strong odor of bug spray, so I asked about it. Mom, a roach crawled into her mouth, so I sprayed a little Raid in there. She said it matter-of-factly, like it was no big deal. Up calls to the police, CPS and a one-to-one sitter for the child and the mom. When all was said and done, the baby was fine and turned over to her grandmother, so no worries there. I have no idea what happened to the mother. I don't believe she was intending to hurt the child. I think she was just butt-ass ignorant. A roach crawled into her mouth. Foul. Just foul. That poor kid deserves better. A little late to the party. Not the worst, but I had a patient once with a stomach bleed and a small bowel obstruction. We had to put in an NG tube that goes in your nose and down to your stomach to drain/decompress his stomach, which was pretty distended and hard. I'm inserting the tube, and as soon as it hits this guy's gag reflex, he projectile vomits and sprays very dark, half-digested blood all over himself, the bed, the wall, and the floor. It's basically a scene from The Exorcist. I had to dive out of the way and somehow was unscathed. He couldn't stop for almost 10 minutes as we're trying to get this thing down to where it needs to go. Finally finish placement and it immediately suctions out 3 liters of this black sludge that is old, digested blood. Patient was mortified and we had to play it off like, oh no it's fine. It's really common to vomit during the procedure. We'll just go get some towels and clean you up. My coworker and I left the room and just stared at each other in silent shock. Not medical professionals, but we were the patients. My daughter, who was 3 at the time, had to have a cavity filled. As we were leaving, the dentist told me just to watch my daughter, because sometimes kids chew their gums, because it's numb and feels weird. So the drive home took 30 minutes, and I had been talking to my daughter the entire time to keep her busy. I park my car in my driveway, opened the passenger seat to get my daughter out, and her entire lower lip on the left side is gone. She had chewed it off down to her chin. She ended up in emergency surgery, but the surgeon kept telling us it would be fine, and he sees this stuff all the time. She ended up having multiple surgeries, and when she was finally healed, the surgeon told us that it was the worst injury like that he had ever seen. He wasn't sure how she would heal, but you can hardly tell it happened now. Oh my god. How do you even react? I'm glad she is okay now. I almost passed out. I couldn't sleep for weeks after. It was so horrifying. I was trying to stay calm for my daughter, but she saw me crying and knew something bad happened. When I was like 9, my sisters and I were watching a movie. She sat on the front of my bed and I couldn't see the TV, so I kicked her off. She gets up, and her arm looks like fucking stairs. She runs to show my mom, not even crying. My mom and dad freak out, so she freaks out. I don't know what it is with kids, but the whole not crying until mom or dad is crying is insane. Not a medical professional, but a story about my father. After years of a blood disease, his spleen had to be removed as it had swollen to a size that made breathing difficult. Apparently the surgeon had a photo taken post-extraction where he is cradling my dad's 22-pound spleen. To top it off, one day into recovery, when doing one of those gentle push on the abdomen type exams on him, my dad's sutures catastrophically failed, and he let loose a spray that coated the doctor, his nurse, and a good portion of the ceiling. Luckily for dad, the hospital staff was on point that day and kept him alive despite his body's best effort. I heard all of this from the doctor while he was removing the line of staples that went from crotch to sternum. Some weeks later, dad didn't like to share, apparently. Had a patient who needed a lower GI study to find/fix a bowel bleed. To get a study done you need to poop clear mucus. 3 days we bowel prepped with heavy laxatives and enemas. He barely pooped anything. He puts on the call light at 6:45, 15 minutes before my shift ends. He calmly says, "I kinda want to try and poop." He said it so casually I figured he was going to toot out another gas bubble and walk back. He stood from the bed, took one step, and the floodgates burst. 3+ days of the most rancid liquid stool I had ever encountered. It just wouldn't stop. He left a river of stool from the bed to the bathroom, coated the walls as he bent to park his bum on the toilet, and continued to dump out 7 people worth of poop. In my 9 years I have never seen that much come out of a person. He was not a large man. He was so embarrassed, but I just kept my face as solid as possible, grabbed half the linen closet and 3 packages of Cavi wipes, and sopped it up. Told him this happens all the time. Edit. Thanks for my first gold. Edit to my edit. Thanks for my first platinum and all the kind words. I love what I do. Lots of stories, many already covered by others. I will share this particular story with my legs crossed. Motorcyclist came in after someone left-turned without checking. He had gone over the hood, slid and somehow somersaulted, landing on his ass sitting up. He slid across intersection mostly on his ass, getting serious road rash. Luckily he was only a block from hospital and ambulance. They pack him and bring him to the ER. We end up cutting off his chaps and jeans and begin the cleanup of gravel and sand embedded in his thighs and ass when all of a sudden, his testicles fall out of his scrotum. He had basically sandpapered a hole in his scrotum while skidding on his ass. The attending pauses, grabs the saline, irrigates scrotum and nuts, fondles them back into place while humming. I handed him some gauze to pack the wound and smiled at the patient who was under a local. Then I went on break, went fetal and heaved. Edit. Thank you for my first gold. While humming. This seems to be a common trick for doctors. Today I learned, not the worst is always the worst, and if the doctor hums, you're pretty much shit out of luck. Someone way up in the thread says they, as a medical professional, hum, because apparently it suppresses your gag reflex. The more you know. If you liked the video, give a thumbs up and subscribe, and check out other videos on my channel. Thank you and have an awesome day.